Hello there. Good to have you on our Top Flight program, Your Health. It is a program that brings health management and makes it accessible and reachable to you, not just at your doorstep, but right inside your doorstep, your home. I welcome myself, yes, like it or not, I am in here. And so let's talk about that salient health challenge that just creeps in on you unknowingly and then begins to do great havoc on you as an individual. But you know what? I am not the health personnel. As usual, always bring in our health personnel who make sure they break it down to the most understandable knowledge that you can get on this platform. It is your health. Okay, today we are looking at hypertension. Yes, hypertension. What is it all about? What are the risk factors involved? Is it a preventable illness? Is it actually hereditary, as many claim, or is something that happens to you because of our lifestyle? These are more you'll get to know about if only you stay with me, and I believe you will. All right, let's welcome my guest. I have Dr. Ngozi Onweme. She is a consultant, a cardiologist, and today we took her from the Asaba Specialist Hospital.
Thank you for having me.
Dr. Ngozi, good to have you. See, when I work with women, they come gloriously prepared, and I tell you, she's fully loaded. So, Dr. Ngozi, let's look at it this way. Hypertension. What is it all about? Because there's been so much audio. Is it audio about nothing, or is it audio about something? So let's look at this audio about hypertension today.
Hypertension, it just simply means raised or high blood pressure in the vessels. It's a serious medical condition that needs to be looked into. I'm happy to be in this forum to talk about it because it causes a lot of premature deaths worldwide. About 1 in 4 men, about 1 in 5 women. WHO has even estimated it that back in 1975, like 594 million persons had hypertension. It has gradually increased. In 2015, it was estimated to be like 1.13 billion. The last report in March last year estimated to be 1.28 billion persons worldwide.
Wow.
So you can see the steady increase in the number of persons having hypertension. In Nigeria alone, it's estimated that like 1 in 3 adults have hypertension. So hypertension simply means raised high blood pressure up to 140 for the upper value of the systolic blood pressure and 90 for the lower value of the diastolic blood pressure and above. So blood pressure up to 140, 90 and above, it's hypertension.
140. But when it's below it, because I've heard some persons say 128, is that like an indices for being high too? 128 over 90 or 122 over 100?
Okay, so classification, there are different classifications. 120, less than 120, 80, it's normal.
Okay.
Between 120 to 139 for the upper value of the systolic blood pressure, and between 80 to 89 for the lower blood pressure of the diastolic is seen as high normal pre-hypertension.
Okay.
But the standard we use most times is from 140 for the upper value and 90 for the lower value and above.
Okay.
So 140, 90 and above. So either 140 for the upper value or 90. So you could have a normal systolic blood pressure, like you mentioned, 128, and you have a diastolic or the lower blood pressure of 100. So that 100 is above 90. So that's
an indication that is still a raised
Yes.
pressure. So it's actually not just about the top being low. It has to be balanced.
both.
Both
So
have to
either
be balanced.
140 or 90. 140 for the systolic or the upper value, or 90 for the lower value of the diastolic blood pressure. Either of them and above, it's hypertension.
Okay, now you know what hypertension means. So when it's a raised pressure, like Dr. Ngozi has said, above 139 to the 140, and then it comes down. Don't go feeling, oh, I'm okay. It's just 90 down or 180 down. Then you think you're okay. No, you're not. You're actually there. is hypertension. Okay, now, Dr. Ngozi, let's look at it this way. The risk factors, because many persons, I know generally we won't say this or this or this causes hypertension, or is there anything like this is what causes hypertension, or should it be more of like a risk factor? What is predisposes one to hypertension?
Thank you for that question. There are modifiable and unmodifiable risk factors. Unmodifiable means the ones that are not within your control, such as advancing age, gender, mainly the male gender, family history of hypertension, and then race. And the African race tends to have more of that. So those ones are not within your control.
Those are the unmodifiable. There's nothing I can do about it. Age must come.
Advancing age must
come. I can't choose where I come from.
Yes, you can't choose your gender. So the modifiable risk factors are the ones you can control. So the kind of diet you eat, eating unhealthy diet, high salt intake in your meals, foods high in saturated fats and trans fats. So that predisposes you to hypertension. We talk about being physically inactive, sitting more, exercising less. That is also a risk factor that you can control. We talked about smoking.
Okay.
Large consumption of alcohol.
They can't help themselves. They can't help themselves. They can't control it. It's a habit. It's just there in the blood. It
predisposes you to hypertension. You have to quit smoking. We're going to talk about that when we go into prevention. And large consumption of alcohol predisposes you. Overweight, obesity, and stress.
Stress.
Yes.
The world is full of stress. Can we actually modify stress these
You can
days?
manage stress. It's like
we can manage it.
You can manage it.
That we can actually eliminate it.
You cannot completely eliminate it.
Okay.
In fact, we need some
stress.
Make
it manageable.
You can manage stress. That's a whole topic of its own. So it's like the last AFCON match. Matches are you know what happened.
You can.
So everybody,
if there's enough chance.
So you can manage it. You know how your texture are, and that you could take breaks in between the matches. You could get up, walk away. You could avoid watching the tense moments, so you can manage stress.
Okay, now we know that hypertension is either modifiable or not modifiable. By being unmodifiable, like Dr. Ngozi has tried to clarify for us, these are things you have nothing to control. You have nothing to do about it. Your race, you can't choose where you come from. You can't choose your age because your age must count. And of course, you can't choose whether you come out a male or a female. Your gender is not yours to decide. But for things we eat, things that pass through our mouth into us, that we can control. How much stress that you go through, you can control it to an extent. You just have to manage it. Things are hard, we know, but then if you die, will that take care of it? Remember, you have families to take care of, dependents, people are looking up to you, even work and everyone. All right, now that we know the risk factors, that this we can have the modified and the unmodified ones. Now let's look at the symptoms. How does hypertension manifest? What do I look at? Those telltale signs that says you are predisposed. That since I can modify, and there are some I can't modify, but what do I look at as symptoms?
Hypertension is actually called a silent killer because it doesn't give you any warning signs or symptoms.
None at all?
It doesn't. That's why it's called a silent killer. So by the time you start having symptoms and signs of hypertension, you're already having organs in the body affected. You're already having complications. So that's why hypertension is termed the silent killer. So many people are walking around about, statistics shows that about 46% of adults are unaware that they have hypertension. That's a huge number. Almost half of adults are unaware. So it doesn't give any sign and symptoms. It's a silent killer. Wow. But there are symptoms and signs that come up when organs are being affected and complications are beginning to set in. I like describing it from the top to the bottom. It helps us to have that. So starting from the brain, it could cause severe headaches.
Okay.
It could cause inability to sleep. It could get very high and cause convulsion or seizures.
For an adult?
Yes.
Have convulsions?
Yes, and seizures. You could even have a stroke, that you know, and then eventually even lose consciousness. Of course, when you have a stroke, a part of the body is paralyzed. So it could come down to the eyes, it could affect the vision, you could lose vision, and if it continues, it could cause complete loss of vision. It could affect the nose, they could have bleeds. Patients who have very high blood pressure come back bleeding, come to the hospital bleeding from them. It could affect the ears because it affects the blood vessels. Remember, hypertension is just the pressure of blood in the vessels. That pressure, when it's high, it hits the walls of the vessels and damage them. So anywhere blood flows through, anywhere the vessels
like
flow
it
through.
can burst through.
Yes, it could affect.
And that is the leakage.
Yes, in the brain, it can burst the arteries and cause bleeding everywhere, and the person goes into coma. That's what we call hemorrhagic stroke. It could have, that's the lose consciousness. I've mentioned that. It could affect the ears, the vessels, the blood vessels in the ears. It could cause hearing loss. Down to the heart, it's because what it does to the heart is
Yeah, because the heart is the one that practically everybody
Yes.
seems to like.
So
the
when,
heart is beating fast.
so when the pressure in the vessels are high, it gives the work extra load, extra work. The heart gets bigger, gets hypertrophied, enlarged, more muscular, and with time it can make the heart, the stress on that heart over time makes the heart feel weak. So you hear heart failure. The person finds it difficult to breathe. Little work the person does, the person feels breathless, tired at night, they cannot sleep, the legs get swollen. It could even affect the arteries of the heart. It could narrow them. The person starts having chest pain. So they'll tell you they have chest pain in the central part of the chest or on the left side of the chest. It's a very serious symptom. It could even completely block the vessels of the heart, narrow them, and then you have heart attack. It could affect the beats, so that the heart to beat the normal locked up, the heart starts beating in a very chaotic way.
Becoming very fast.
Very fast and chaotic. And all this would affect the person. Down to the kidneys. It can affect the kidneys. The person's face gets swollen, the legs are swollen, you cannot pass urine the way you should, the quantity of the urine, the color of the urine changes. There are so many
So
patients.
like when the color of the urine changes, what color what color do we look at for?
The urine normally is light amber or light yellow.
Okay.
It could be dark concentrated if you don't take enough water.
Okay.
But it could become bloody. It could
Bloody?
Yes, it could. So it could even reduce the quantity of the urine the person passes, and then the person has kidney failure.
Okay.
I'm sure you've heard of many patients who are going to dialysis. Dialysis is very expensive. It's
Very,
not something you
very,
want to
not
go into.
even afford. It's not
For the
cheap.
men, it could affect their erection. You could have erectile dysfunction.
BP.
Yes.
What
Because you know
BP
it's
got to do with libido sexuality.
like I said, the high blood pressure means pressure of blood in the vessels.
Everywhere.
So anywhere blood flows through, there are blood vessels everywhere. It affects them. It damages the arteries. It makes them thicker. They are not as elastic as they should be. So they are stiff, they are thickened. It causes plaques, fatty plaques to deposit on those arteries, thereby narrowing them. Instead of them to be as wide as they should, they become narrow. Those plaques could even travel, flow with the blood.
With the blood
Yes, if they can dislodge from the arteries where they are
deposited.
yes, and they could travel with the blood. And when they get to a blood vessel that is not wide enough,
They block it.
it blocks it. So that's what causes stroke. It can have that's what also affects the heart, causing heart attack we hear about. So even in the males, it can cause erectile dysfunction. It affects the blood vessels of the male organ down to the legs. It can affect the blood vessels of the legs. It makes the vessels stiff, thickened, not enough blood flowing. So the person starts having aches, pains, cramps when they walk, when they climb steps, which relieves them when they stop and rest. If they have injuries, it won't heal quickly because blood is not flowing. So it affects practically almost every part
segment
of
of the body.
So it's something if you can avoid or prevent, pressure exists.
All right, if you're just joining us, this is the program, Your Health, and today we have Dr. Ngozi Onwime in the house. She's a consultant cardiologist from the Specialist Hospital here in Asaba. And of course, we'll be looking at hypertension, how to modify your lifestyle, yes, because like Doctor mentioned earlier, there are some parts you can modify and there are some things you cannot modify. Things like age, things like sex, things like race, you cannot determine, but that which you consume is something you must have to control. Okay, a break beckons now. When we come back, I still have a consultant cardiologist in the house still with us. Thank you so much for still staying with us. This is the program Your Health, and today we are looking at that silent killer, talking about hypertension. And Dr. Ngozi Onwime is in the house. She is a consultant cardiologist, and she has defined our issue that it is just simply raised pressure in the blood, and it becomes complicated when we do not modify how we take care of ourselves. A lifestyle is very important. What you eat, talking about alcohol, smoke, and excessive uncontrollable consumption of what you shouldn't consume is a risk factor that tells you hypertension will just be telling you, I'm coming for you. I am coming for you. And if you don't say, stay away from me, then it will definitely step into you. Okay, now we've looked at the definition, the risk factors, who is predisposed, and we know that a lot of men and women are predisposed. No one is exempted. Everyone could actually become a victim of hypertension. All right, let me stop playing, Doctor. Yes, we have Dr. Ngozi in the house. Dr. Ngozi, good to have you back after the break. So far, we've looked at the definition, the risk factors. Now, let's look at the preventable measures, or rather, how do I put it? Let's look at the preventable measures of hypertension.
It is, first of all, for you to know you have hypertension, you have to know your numbers.
Okay.
So knowing your numbers means you have to check your blood pressure.
Okay. Okay, not like me knowing my numbers of 1 to 10.
Yeah, you have to check. You have to know the number above the systolic blood pressure. You have to know the number below the diastolic blood pressure. So how do you know your numbers? It's just simply by checking the blood pressure. You have
how
to.
Do I check?
There are monitors that help. Okay. Apart from those hospital ones.
Okay, so I don't always have to come to the hospital to do
no, in fact, we advocate offices having blood pressure apparatus. I believe you have one here. So you can check your blood pressure in the workplace. You can check at home, good enough. There are a lot of pharmacies out there that have a BP monitor. So you could just walk into any of them if you don't have a BP monitor at home and check your blood pressure with those monitors.
Is it necessary for every individual to own theirs, or at least I mustn't own it? I can just walk into a pharmacy.
It is wise to own one if you can.
But that is if I am a diagnosed hypertensive.
Even if you are not, because we talked about prevention, right?
Okay.
So primary prevention means you probably don't have it, but you have to monitor and keep watching and checking so that you advance in age. Remember we talked about that.
Age.
If it starts creeping in, you quickly get it, you quickly catch it on time before it starts causing complications. Okay. So it's advisable for everyone to own one. But even if you can't, you can still make use of the blood pressure apparatus in your workplace, in the pharmacies close to you, or wherever. You can even walk into clinics, hospitals, and tell the doctors and nurses there, please, can you help check my blood pressure?
I can walk into a hospital and ask.
Yes. Why?
I don't have to like start queuing up for a doctor to say I came for consultancy, I just walk in, maybe the accident and emergency, I said, please, I just like to check my BP. Would they do that?
It can be done. But usually why we advocate you open a folder is that you never really know what they will find out.
Okay.
And the folders help for recording.
Okay.
It's a legal folder.
Okay.
And so it helps for recording. So when they check, they document.
Okay.
You look at your pulse, they document. That's your own record. So tomorrow you have any need for a checkup, you come, you have your record.
Okay, so how often should one actually do the check?
As often as possible. So for those who are not, like I talked about primary prevention, if you are not hypertensive, you've checked, today is not there, tomorrow is not there. For those who are not hypertensive, you can check less often. There are particular numbers or particular times. Once a week if you are not hypertensive.
Okay, but if you are hypertensive?
If you are hypertensive, you need to check more often.
Like every 2 days, every 3 days?
Every day if possible, depending on how your control is.
Okay.
So we're talking about prevention. First of all, know your numbers, check often.
Okay.
If you check and you are not hypertensive, that means your blood pressure is not above 140/90 and above, then you don't have to check so often. What you have to do now is those lifestyle modifications we talked about, prevention. So your diet, eat healthy diet, eat more fruits, more vegetables, more nuts, whole grains.
When you talk about nuts, we're looking at cashew nuts, ground nuts. These are the nuts we're looking at.
Nuts, walnuts.
Walnuts, okay.
So lots of fruits, lots of vegetables, whole grains, protein, reduction in salt intake. Remember we talked about high salt intake increases hypertension or can lead to hypertension.
Okay, so
Reduction.
the person have to take little or no salt?
In fact, it's advised no added salt.
After
on table.
cooking
Yes.
on the table, okay, no table salt.
And of
Always
course the
add
salt you put
while
in food
cooking.
should be in moderation.
Okay.
Yeah. So less of fatty foods.
I like fatty
Saturated,
meats.
less of saturated fats. Saturated fats are more from animal sources. Those are the fats that become solid in room temperature. So unsaturated
And
fats,
those fats are so delicious when you have
butter,
them cooked.
margarine, they are, but they are high in cholesterol and can predispose you to hypertension.
Okay.
So less of fatty food, less of, talked about salt. Prevention still, be physically active, exercise, jog, brisk walking, swimming, dancing, exercise, 30 minutes at least each day. It's not much. Those exercises keep hypertension away. Keep your circulatory system working very well. Keep your heart healthy. We talked about quitting smoking.
It's a must now.
Quit smoking. Smoking hardens the arteries, damages the arteries, predisposes you to those fatty plaques depositing on them, narrowing the arteries and causing some of these complications we've talked about. So quit smoking, alcohol in moderate consumption.
If you must.
Large intake of alcohol still causes
Hypertension.
hypertension and heart diseases.
Okay.
Lose weight.
Okay, lose weight. Very, very important.
Lose weight. Overweight, obesity, predisposes to hypertension, manage stress.
Okay, before I let you go, I've heard some patients claim that I had an accident, it led to BP, I was pregnant, especially with women. They say BP in pregnancy. So let's quickly look how to manage it and just put it into your advice, because time is not a friend anymore.
So when you check and the blood pressure is high, even in pregnant women, some women who are not hypertensive but when they're pregnant, and once we get up to 140/90 and above, you have to treat. Now, we always advise not to walk into any shop and just buy.
Buy medication.
Yes, my spouse has blood pressure, let me collect his own medication and take. No. Come to the hospital because the doctor looks out for other risk factors that the shops will not look at.
Because they are pregnant women now.
Yes, for anybody pregnant, they'll look out for other risk factors and they'll start you on medications. Those medications help to, remember we talked about hypertension making the arteries stick, they are no longer elastic, they are stiff, they are narrow. So some of those medications help your blood vessels to relax so that the pressure in them falls. It helps, some of them helps your heartbeat that is fast to slow down. Like for pregnant women, they'll give you medications that will keep you and your baby safe. But most importantly, that blood pressure comes out so the baby can grow well and come out healthy. And then they'll give you drugs to, if your heart is beating too fast, it will calm down. Some of these drugs, I won't stress on this, makes you to urinate more often. You hear some patients complain that the medicine the doctor gave me, I'm urinating too much, I had to stop it. That urinating helps to remove excess fluids and salt and brings down the blood pressure.
Okay.
So that's how it works. So you avoid taking it at night, so it doesn't affect your sleep. But you need to take your medications.
Hi, thank you so much, Dr. Ngozi Onwueme, consultant cardiologist at Sabah Specialist Hospital. We've been chatting with her, and in fact, how would I say it now? My eyes are open. She has just actually opened my knowledge box to a whole lot of things. And if you're out there, I know, like I said, the fatty meat tastes is very tasty. But Doctor said that is where you actually need to roll. And knowing your numbers to check regularly, 140/90 is a way to go to. Is a way to go so that you know, am I hypertensive? Do I really need to go see Dr. Ngozi, or can I just modify my lifestyle? All right, that is it. Just know your numbers, exercise, eat healthy, stay out of trouble, avoid substance abuse, and I tell you, you're good to go. Dr. Ngozi, thank you so much for coming on our platform.
Thank you too.
And to you too, thank you for always being there, because without you, what are we doing here? On behalf of the crew, I say thank you so much. Stay healthy. Salutes. Goodbye.
Thank you.